Welcome to page 45 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The muscles of mastication. Mastication means chewing. So these are the muscles you use to chew with. Starting with the temporalis muscle. Temporalis muscle is aptly named because it rests, or it originates mostly on the temporalis bone, right on the side of the skull, right on the side of the head. Obviously, you can see it extends originates also from the frontal and the parietal bone as well, but the temporalis, the temporal bone, lies directly underneath. You can see how it inserts, it comes to a point, comes from a big, large fan-shaped muscle, and then down into a tendon that it goes underneath the zygomatic arch here of the temporal and bone and zygomatic bone to insert on the coronoid process of the mandible. Coronoid process is right here. That's the coronoid process. So it grabs that coronoid process, and it's a massive muscle, as you can see. Well, for a head muscle, reaches in, grabs, and pulls and yanks that coronoid process upward to assist in mastication. And here is the temporalis muscle. Temporalis muscle on the side of the head. It's been resected now to show the muscles underneath. And what else has been resected is the zygomatic arch and cut out. So we can see the muscles underneath. Here it is again. And you can see how it begins to narrow as it goes under the zygomatic arch and comes to a point right down here where it inserts on the coronoid process here. And you can imagine this muscle pulling upward this way. That's exactly what it does. It elevates the jaw, elevates the mandible. That is its job. Also, because of its angle from posterior to anterior, it does pull a little bit backward this way into what's called retraction, jaw retraction. You can see the angle down here of the insertion pulling this way as well. So it is also a retractor of the jaw, temporalis muscle. Next, the masseter muscle. And by the way, you can palpate that temporalis muscle on the side of your head above your ear. You can feel it contract as you clench your jaw down. And here's another one you can feel too, right on the side at the angle of your jaw. Big, powerful muscle called the masseter muscle. The masseter muscle. It arises from the zygomatic arch here, originates here from the zygomatic arch, and then wraps around. You can see it's cut here. Wraps around the angle of the jaw to also pull it upward. Here it is right here. Pull it upward. It's been resected, it's been cut. And so it is also an elevator of the mandible. And cut away here. It's been cut away here as well to view the pterygoid muscles underneath. And that brings us to the medial and lateral pterygoid, the pterygoid muscles. These muscles cannot be palpated. They're not outside of the skull, they're actually inside. You can reach way, way, way up inside the mouth and in to the side of the jaw and possibly palpate them, but they're not accessible from superficially from the outside. Medial pterygoid originates from the palatine bone and from the sphenoid bone here, up in here, deep inside the skull, and then inserts at the angle of the jaw, the medial interior angle of the jaw of the mandible. Its job is to move the mandible sideways. So you can see the medial pterygoid here, inserting at the angle of the jaw from the inside here. And you can see how the left pterygoid muscle would pull on the jaw, or to the opposite side. The right pterygoid would pull the jaw to the left, and the left pterygoid would pull the jaw to the right. Also, it is involved in protruding the jaw or pushing the jaw outward. If both of your medial pterygoids contract simultaneously, you would see how they could push your jaw outward. It's the medial pterygoid muscle. Now, the lateral pterygoid muscle here, lateral pterygoid muscle, comes deep and originating from the sphenoid bone, but not inserting at the angle of the jaw down here like the medial pterygoid, but is inserting at the condylar process. And so creating a different angle of pull, but accomplishing the same lateral deviation of the jaw. When one acts at a time, it will deviate the jaw in the opposite direction. When they both act simultaneously, they will protrude the jaw outward, pull the jaw in this direction. And lastly, depression of the jaw, pushing the jaw downward or opening the jaw, opening the mandible. It's the lateral pterygoid muscles, when they act bilaterally or at the same time, both of them will bring the jaw downward. And this is page 45 of Anatomy Coloring Book. This is Dr. Stephen Harkins, Muscles of Mastication.